Hello, and welcome to the Mosquito Minute, brought to you in partnership with the Johns Hopkins Malaria Research Institute. I'm Mariska Suben, Africa correspondent at the Naked Scientists, reporting from the front lines of malaria research, mosquito control, and the fight to save lives across the continent. Africa remains at the center of the global malaria crisis. The continent accounts for around 95% of all malaria cases, placing immense strain on health systems and costing hundreds of thousands of lives each year. In 2023, there were an estimated 249 million cases globally, with the vast majority in sub-Saharan Africa. So why does malaria persist so strongly here? Part of the answer lies in the mosquito. As one of the most efficient disease vectors on Earth, the mosquito called Anopheles gambiae is highly adapted to bite humans and transmit infection rapidly. Climate also plays a key role. Warm temperatures, seasonal rains, and standing water create ideal breeding conditions, allowing mosquito populations to thrive. But malaria is not only driven by environment alone. Limited access to healthcare, gaps in prevention, and challenges reaching rural communities all sustain transmission. Together, these factors continue to drive one of the world's most persistent infectious diseases. I am Mariska Suben in Johannesburg. We are now going to examine the focus of malaria in Africa with Chris Smith and Bahuma Tatanji, a Cameroonian-born physician-scientist at Emory University in Atlanta.
Thanks very much, Mariska, and welcome to the Mosquito Minute, Bahuma. Why is malaria such a massive health issue in the African continent, which accounts for the vast majority of malaria cases and disease burden worldwide, doesn't it?
Yes, it does. I think of malaria in Africa as essentially the perfect storm for three reasons. First of all, the vector, the mosquito that transmits malaria, the species in Africa, Anopheles gambiae, is the most efficient malaria vector on the planet, and it really thrives on the continent. And then in addition to that, Plasmodium falciparum, which is the deadliest form of the malaria parasite, is also the predominant parasite that exists on the continent. When you add to that the perfect climate conditions for the vector to thrive, as well as limited health infrastructure, then essentially you have the conditions that allow malaria to really thrive on the continent, leading to about 600,000 deaths globally, with most of them happening on the African continent and primarily impacting children under the age of 5.
Which bits of the African continent are most acutely affected? Because South Africa is spared down south. There are bits of northern Africa which don't tend to report much malaria, if any. So which bits are worst hit?
Yeah, the worst hit bits are mainly the very heavily forested parts of the continent south of the Sahara, all the way down to just before South Africa and then Eastern Africa as well. And to really define these areas, you have to go by the rainfall, the temperature. Usually malaria vectors thrive in temperatures between 20 to 30 centigrade, because we know that temperature range that both accelerates the mosquito development as well as the maturation of the parasite within the mosquito. So when you start thinking about parts of the continent that may not have those favorable temperature and the type of humidity that is required by the vector, that would explain why you may see less malaria, say, in the cooler parts of South Africa or in the extremely hot parts of Northern Africa that are in more of the Sahara Desert.
And how many people and what fraction of Africa's population overlap with the sweet spot for malaria that you were just outlining?
Well, 95% of the world's malaria burden is within the African continent. And every year when you think about the millions of cases that are reported, that is about 70% of the continent that is directly impacted by this high burden conditions for malaria.
And how might those conditions be tweaked by climate change? Are things going to get worse, or will things get better with what we think will happen to the climate in the future? Because that's going to impact temperature, which you pointed out was important. It's going to impact rainfall, which you highlighted as an important factor as well. So how will that change?
Well, we are already seeing the impact of climate change on malaria transmission, and it's actually impacting this negatively. As I mentioned previously, the mosquito parasite thrives in warmer temperatures. And what we are seeing is that even in some of the countries where malaria was rarer in highland parts of the country because of the cooler temperatures, as we see the climate start to warm, we're seeing malaria cases being reported in cooler parts of the continent as those temperatures start to rise. Additionally, with climate change, we're also seeing more rainfall as well as more flooding. The malaria vector likes puddles of water and irrigation channels, as well as slow moving water. So, when you have a flood scenario, you can imagine that that creates, again, ideal conditions for the malaria vector to really thrive and for there to be a boom in cases as the climate changes.
And what about beyond Africa? Because if we are seeing these changing conditions, presumably there will be some places on Earth that become much more propitious than they are right now for the parasite and for the vector, and therefore could become a disease nidus in future.
You're absolutely right on this. Just in the last 2 years in the United States, there have been several cases noted of local transmission of malaria in the southern states like Florida, where you've had mosquitoes that are capable of transmitting Plasmodium vivax, which is the predominant malaria strain in Central America, being able to effectively transmit the parasite within the US. That again is a marker of the changing climate, and we are likely to see that happen even more frequently. I would caveat that with the fact that in temperate regions, at least you have the winter months where temperatures drop and allow a huge dying off of the vector, which is an advantage that makes it harder for the vector to really entrench itself and have transmission all year round. Whereas in Africa, you have those warm temperatures all year round. And in those 70% of countries on the continent that carry the highest malaria burden, you're seeing transmission happen all through the year.
And to combat that all through the year transmission, what are the most effective interventions? What can we do that we know works?
Fortunately, there are lots of strategies. The three main ones would be insecticide treated bed nets, indoor residual spraying, as well as chemoprophylaxis for prevention. So, taking malaria drugs to prevent developing a malaria illness. Now, long lasting insecticidal nets have been effectively cost effective in preventing malaria and have actually saved millions of lives. And indoor spraying targets the resting vector inside houses. So when the mosquito vector feeds, it usually rests on the walls of houses. And when you spray the walls, you can actually target these vectors within homes and reduce transmission. And of course, hemoprophylaxis has been delivered to children under the age of 5 as well as pregnant women as a way of preventing malaria. The fourth prong, which is relatively newer, is the introduction of malaria vaccines, which are now available for infants under the age of 2. And in the past 2 years, we've seen the rollout of the two pre-approved malaria vaccines, the RTSS and R21, in countries across the African continent.
Those are relatively simple in the grand scheme of things interventions. So what are the roadblocks that are stopping African countries implementing them and therefore getting down this burden of disease?
We have all of these tools, but I think the key part is being able to get the tools to those who actually need them. And one of the issues that malaria has faced recently has been the decline in funding support for initiatives to actually target malaria. Malaria happens sometimes in remote parts of these countries where it can be challenging to actually get mosquito bed nets to people living in very entrenched areas, and also more challenging to get vaccines delivered to these areas as well as medication for chemoprophylaxis. So the big barrier here is having additional funding that allows us to get these resources to those who need them the most.
My thanks to Bahuma Tatanji at Emory University and Chris Smith. The Mosquito Minute, brought to you in partnership with Johns Hopkins Malaria Research Institute. You can now follow us on Instagram and LinkedIn. Music in the program is sponsored by Epidemic Sound, perfect music for audio and video productions.